A sepsis and septic shock are medical emergencies, and we recommend that treatment and resuscitation begin immediately because with every passing minute, the mortality and the morbidity increases. If we are not starting the care of the patient, the resuscitation of the patient immediately in the emergency itself, we end up harming the patient. We can increase the mortality of the patient. I should say, if we are not following the bundles of sepsis, we are doing crime against the patient. So, there is a Surviving Sepsis Campaign, and the recommendation for initial resuscitation includes at least 30 ml per kg of IV crystalloid should be used in the first 3 hours of resuscitation. Now, this choice of crystalloid, it is always crystalloid. We should not go for colloids or anything else. And the choice amongst the crystalloid, the choice is always balanced crystalloid. Now, balanced salt solutions, there are various preparations available in the market. They are the fluid of choice for resuscitation in case of sepsis. Because they are said balanced because they are very close to the plasma osmolarity of our human being. Our body osmolarity and the fluid osmolarity is very near. If we use NS, normal saline, when we are using it in higher amounts, say 1 to 2 liters, 30 ml per kg, if I say it is a 60 kg individual, 1.8 liters of fluid or saline that we have to give. If we are going for normal saline, if you check the content or the composition of normal saline, the amount of sodium and chloride is very high. The osmolarity of the fluid is very high. So ultimately, it leads to hyperchloremic metabolic acidosis. Already the patient is in sepsis, metabolic acidosis, higher lactate levels, and we are further deteriorating it by giving normal saline, leading to hyperchloremic metabolic acidosis. That is why the fluid of choice for resuscitation in sepsis or whenever larger amounts of fluids is used is always a balanced crystalloid solution. Now, it is very tricky to give fluids to a patient of ischemic heart disease or a renal patient. So we have to be very cautious in special situations where there is fluid restriction for the patient. And resuscitation should be guided to decrease the serum lactate levels in these patients where the lactate level is more than 2. So in adults with septic shock, use capillary refill time to guide the resuscitation as an adjunct to other measures of perfusion. Use dynamic measures to guide fluid resuscitation over physical examination or static parameters alone. You can use or you can resuscitate the patient with fluids in the bedside using an ultrasound by IVC guided fluid therapy. If you measure the IVC, there is more than 50% collapsibility of the IVC or the inferior vena cava. You know that the patient will be fluid responsive or is fluid deprived. So giving fluids to this patient will do better for the patient, clear the lactate level. But if you see that the IVC is like a tube, it is not varying with respiration. There is no variability. It is like a lead pipe without any variability with respiration. This patient will not benefit from fluid. If you give too much of fluid, patient will go into pulmonary edema and you will harm the patient rather than doing any benefit. So we have to be very cautious. Blanket 30 ml per kg of fluid cannot be given to every patient. It has to be patient specific. But the resuscitation should start immediately. Other things which we can use bedside is like passive leg raise or a fluid bolus to check stroke volume variation, pulse pressure variation, echocardiography, wherever possible we can use. Nowadays, ultrasounds are the stethoscope of the doctors, especially in the emergency and the critical areas. So we should be using the techniques which are available or the tools which are available with us and do.
So passive leg raising test is a very simple bedside test which can be used to check the fluid responsive of the patient as a simple bedside physical test. We can just raise the legs of the patient passively to around 45 degrees Look at the monitor for the change in the pulse pressure. If it is more than 10% variability, you can see in the monitor, the patient will definitely be fluid responsive. The test is 79% sensitive and 85% specific for fluid responsive checking for the patients in sepsis.